everyone. This is Dr. Maya Gorbel coming to you from Millennium Medical and Rehab. We are making some informative videos about exercises for pregnancy, and also we released a podcast just last week about staying healthy in pregnancy. Today I'd like to go over with you some changes that happen to the musculoskeletal system in pregnancy that cause a lot of the back pain issues that women experience and some of the pelvic floor issues a woman might experience. And I'll show you some exercises you can do to keep yourself healthy during this time. So during pregnancy, as the uterus grows and your belly expands, your abdominal muscles stretch a lot as well, and so that can make them weaker. Also, as your belly gets bigger, that pulls your center of gravity forward and also causes a forward tilt on your pelvic bones. So your pelvic bones go this way, and this also increases the curve in your lower back and puts more pressure on your lower back and your sacroiliac joints in the back. This can all contribute to low back pain. As you know, core muscle weakness can cause low back pain, and so in pregnancy this is especially an issue. Also during pregnancy you have a hormone that gets released in progressively larger amounts throughout pregnancy called relaxin. This is meant to loosen up the bones and ligaments in your pelvis to really prepare you for the birth of the baby, to allow the pelvis to have more flexibility, which is wonderful for birth, not so wonderful when you experience some joint laxity as a result and some pains as a result of that too. So some things you can focus on to get yourself stronger and feeling better during pregnancy include strengthening of the core muscles, the pelvic muscles on the outside of the hips, and then also the pelvic floor muscles too, because there is also a stretch on the pelvic floor muscles during pregnancy, and of course during labor that puts immense pressure on the muscles of the pelvic floor, and that can cause weakness of those muscles, and it can lead to other issues after delivery, such as urinary incontinence and frequency. So first I'll show you a couple of core stabilizing exercises. The first one is using a ball. So you sit on a ball, you find one that is appropriate for your height. You can get a TheraBand. So when you sit on the ball, you make sure your posture is straight and engage your core muscles when you're doing this. And then just pull on the TheraBand. And this is a very good core stabilizing exercise. You have to work on your balance here as well, because you're sitting on this ball. Make sure when you're doing this you are engaging your core muscles and keeping your shoulders down. You can keep the stretch on the TheraBand for about 5 seconds at each angle. You can change each angle around. And repeat each angle 5 times or so. If you don't have a TheraBall, a ball or a TheraBand, you can also do exercises against the wall in a modified pelvic tilt exercise. So if you stand against the wall with your knees slightly bent, make sure you're in a comfortable position, and you can keep one of your hands between your low back and the wall, just for some feedback for where your back is. And then you kind of tilt your pelvis and push your low back into your hand or into the wall. And at the same time, you can also use the other hand on your belly and try to engage those muscles. And the hand on the belly gives you some feedback for that too. So you hold it for about 10 seconds, the contraction, and then you can relax. And then repeat that about 10 times, 2-3 times during the day. And this is a modified pelvic tilt exercise, which is a great exercise for core strengthening, typically done flat on your back. However, during pregnancy, it's advised against laying flat on your back after 20 weeks of gestation, because the growing uterus can put a lot of pressure on the blood vessels, and that can cause some issues with blood pressure and blood flow. So the next exercise I'll show you will be a plank, which is also a very good core stabilizing exercise. So instead of doing a plank on the floor like you may normally do, it is safer during pregnancy to just do it against the wall. So put your arms up against the wall, feet about a shoulder width apart, and really lean into the wall, and you can engage all of your muscles, muscles of the back, muscles of the core, and hold it for up to 30 seconds, even longer if you can. And you don't have to start with 30 seconds. You can start with 5 seconds or 10 seconds and really work your way up. And this is a really good exercise that engages your whole core. Also during pregnancy, it is important not to do any core exercises such as sit-ups or crunches, things where you lay flat and then you have to sit up forward, because that can actually increase the risk of separation of the abdominal muscles instead of strengthening them like you want to do. The next thing I want to show you is a clam exercise, which is very good for strengthening the muscles on the outside of your hips, which are some of the pelvic stabilizer muscles like the glutes. So you basically lay on your side, get in a comfortable position. You can put one hand out here onto your glute, again for some feedback that you're contracting the muscles. And then just raise your leg and contract the muscle out here. Hold the contraction for about 2-3 seconds and then relax. And you can do this in a set of 10, again 2-3 times a day. The last exercise I will show you is an exercise also for the glutes and also the pelvic floor. So instead of laying flat on your bed, you can use a wedged pillow or put a couple of pillows up to elevate your back. And this is an exercise called the bridge. So you lay on the pillow, feet flat on the table or on your bed or on the floor, and then you elevate your hips and your buttock and squeeze your buttock and try to activate those muscles. You can hold this for 2-3 seconds and then relax. And then again, also repeat a set of 10, 2-3 times a day. When you are pregnant and you're going to sit up from a laying down position, don't sit up straight forward, right? Because that puts more pressure onto your abdominals and can increase that separation of abdominals. Instead, what you need to do is turn over to your side and then use your upper body to lift yourself up. Like so. Or you can even lay down and turn yourself over and lift yourself up from the front up. So that's even more comfortable for you. If you have any questions, please give us a call. 914-472-2700. We'll be happy to address any of your musculoskeletal discomfort, pain needs during your pregnancy or postpartum period. Any other issues that you may have, we can also help you with during this time. Thank you for watching, and we'll be glad to see you soon. Again, it's Millennium Medical and Rehab. We're at 914-472-2700, 1075 Central Park Avenue, Suite 107 in Scarsdale, New York. Take care.